Everyone says health insurance is not affordable. How can you say that it is?
It's interesting you use the word affordable. The reality of it is, how can anyone afford not to have health insurance? The average emergency room visit in the United States right now is $5,000. The average hospital, 3-day hospital stay is over $20,000. The reality of it is people cannot afford to go without health insurance. In this country, if you're without health insurance right now, you are one major medical event away from bankruptcy. Up to 1 million upper and middle class families each year in this country file bankruptcy because of health care related bills. So the reality is you can't afford to go without health coverage.
Especially with what's going on with Congress, right?
It's exactly right. And you know, I always like to say citizens should not sit back and wait on politicians to fix this problem. The reality of it is you should empower yourself, and that's what I enjoy, educating people on how to buy their own coverage so they're in a position where they do not have to sit back and wait on politicians to solve this problem. Trust me, folks, we do not want Congress managing our health care system.
But what about the premiums?
Well, premiums are a matter of education. If people understand how the system works in this country, they're going to be able to use it to their best advantage. I like to use the old analogy, why buy a Cadillac when you can get by with a Chevy? The reality of it is a Cadillac is going to cost you a lot more to purchase and a lot more to maintain throughout the year. But both of them will get you from point A to point B. Health insurance is very much the same way. If you buy a high deductible plan, you're going to have a lower premium. If you buy a low deductible plan, you're going to have a much higher premium. The reality of it is, though, we can generally save you more in premium dollars per month and per year than the added exposure that you have in terms of deductible risk. So let me give you an example. For instance, a $500 deductible plan could cost you around $500 a month in premium. A $1,500 deductible plan would run you about $325 a month. That's about $175 a month premium savings. $2,100 a year worth of guaranteed premium savings per year. Now, if you do have that major medical event, which once again primarily applies to an inpatient or an outpatient surgery, you may have an additional $1,000 worth of out-of-pocket exposure, but we've saved you $2,100 in premium, so you still end up $1,100 a year ahead of the game.
Exactly how will the high deductible plan benefit me?
Well, the number one way that a high deductible plan will help not only you, but everyone, and that is with lower premiums. Most people in this country that do not have health insurance don't have health insurance simply because they feel that the premiums are too high. By buying a high deductible plan, we can get lower premiums. I would far rather be in a position where if I had a $2,500 deductible plan, I ended up with a $2,500 hospital bill as opposed to a $75,000 hospital bill because I had no health insurance at all. So number one, the lower premiums should equate into more people being able to afford to buy their own health coverage. Number two, once again, as I said, the high deductibles generally only apply to major medical events, inpatient surgery, outpatient testing, those types of things. And in those cases, those are fortunately the least likely events to happen in most families. But the things that we're most likely to experience, as we all know, are doctor's visits, prescription drugs, and emergency room visits. Fortunately, with many of these high deductible plans that we're saving now, we can put you in a plan where you have $25 office calls, $15 generic drugs, $30 brand name drugs, and sometimes as low as $100 deductible for emergency room visits. But most importantly of all, the key here is to put people into lower premium plans and protect their insurability and keep them out of bankruptcy.
All right, you mentioned doctors and hospitals. Well, I keep on hearing on the radio and television companies advertising health insurance to self-employed and small business owners through associations. And they say you can use any doctor or hospital. Well, that sounds too good to be true, is it?
Well, simply because an insurance company is targeting small business owners and self-employed people doesn't necessarily mean that they have any special plans or any special prices. In most cases, they're simply using that as a ploy to try to get you to purchase your coverage from them. And in a lot of those cases, they also force you to become members of associations or have membership dues, which really only provide a lot of fluff and really add no substance to your health care. If you have not heard of the name of the insurance company that is soliciting your business, the chances are your doctors and hospitals haven't heard of them either, and in all likelihood, they're not going to accept those plans. If you are in doubt as to whether or not you have a plan that is going to be accepted by your doctors and hospitals, or you're in the market for a plan, call the professionals at Beacon Associates. We only recommend, or we only work with, brand name reputable companies, and we will make sure that it's a plan that your doctor and hospital is going to accept.
Okay, wait a minute. What do you mean by brand name reputable carriers?
As is the case with many things in life, not all insurance companies are created equal. Brand name reputable carriers are companies that basically have good ratings, good market recognition within the marketplace. We only work with those companies, and the benefit to you is we're working with insurance companies that your doctors and hospitals are going to recognize and accept, and in the end you're going to pay less.
All right, well, I polled the audience earlier and I got some questions from them. The first one is, my employer says he cannot afford to buy me health insurance. Can you help him?
More importantly, I can help you. The reality of it is, out of 47 million uninsured in this country, over 80% of them have jobs that do not provide health insurance. In this country, people are health insurance slaves, and simply because they do not realize that individual health care is affordable for them. Folks, do not let your job dictate whether you're going to have coverage or not have coverage. Empower yourself, go out and buy your own health coverage, take this issue away from the hands of the politicians, and make sure that you have a plan of your own. Don't leave it up to your employer to solve this issue for you. And yes, I can help your employer. Hundreds and thousands of self-employed contractors and independent contractors each year go without health insurance on themselves simply because they don't know individual coverage is affordable to them. And the reality of it is they are one major medical event away from bankruptcy. We can help those folks. Have your employer call us. We have hundreds of creative solutions to help employers find plans that will fit into their budget, plans that they can offer to their employees.
Jones and Lavender had a group policy, and I had a family policy under that group. Steve Wise suggested that I split my family policy and I stay in the group, and my husband and my children go on their own separate non-group policy. And he suggested that, and I said, Steve, why would I do that? And he said, well, if you do that, you can save over $200 a month. So I looked into it, I did it. We still have the same exact coverage that we had when we started the process, and it's still over $200 a month savings. I have the same policy, and so does my family, that they had originally. They're always ready to help me if I call, but we never dreamed that we would have that kind of savings.
Call the professionals at Beacon Associates now. Allow us to teach you the secrets that politicians and health insurance companies don't want you to know about purchasing your own health insurance coverage. One of our licensed representatives will collect vital information from you that we could use to search the marketplace to find a plan that best fits your needs and also fits into your budget. And once again, remember, our service is 100% free. You'll not pay 1 penny more with any of the carriers that we represent.